distinguished administrators, you've heard 3 presentations so far. 2 were very well presented, probably written by a paid consultant. The presenter just ahead of me was very humorous, and I won't say too much about him since we work at the same institution. But I want to speak to you really from the heart, and to let you know what being an obstetrician gynecologist is really like, and also to convince you that even though all of these specialties may be great and fantastic, that the one that you really ought to preserve is the specialty of obstetrics and gynecology. Well, who or what is an obstetrician gynecologist? Well, we take care of females. We take care of the offspring of females. Now, why is that important? I don't know what your religious beliefs might be, but somewhere we are told that this world was created and the first person that was created was a man. But for some reason, perhaps some special reason, it was determined that a world of all men would be a disaster. And so, women, a female, was also created. And not only was that female created, but that female was created in such a way that they would be able to produce other people to populate this world. And so therefore it's very important, it's critical, that for the survival of humankind, for the survival of our world, we need women. We need healthy women. And therefore it's critical that we have a body of specialists, a body of physicians who are trained to take care of the needs of women. Now, statistically, there are more women than there are men. Again, magnifying the need to have individuals who are prepared and well trained to take care of this body of the population. In New York, the majority of the population is women. We live here in New York, you are being trained in New York, therefore it is critical that you maintain a training program, a medical program that is able to take care of women, all the needs of women. When I graduated from medical school in 1969, I guess that makes me the most senior of our panelists. That may not be too good. But we were all given, our graduating class, a copy of the Hippocratic Oath, which was written about 5 BC, I understand. That oath was rewritten in 1965 by former dean at Tufts University. And the contemporary version of that oath, there's one little paragraph. It says, "I will respect the hard-won scientific gains of those physicians in whose steps I walk, and gladly share such knowledge as is mine with those who are to follow." And I would like to urge and convince you that as an obstetrician gynecologist, I think it my responsibility to pass on that knowledge to individuals who will be able to take care of women's health needs in our society today. Now, obstetricians are also internists. We have to treat diabetes in pregnancy, hypertension in pregnancy, sickle cell in pregnancy, all of the medical conditions that affect women in pregnancy. We are trained to take care of those. As gynecologists, we are also surgeons. As obstetrician gynecologists, we are also psychiatrists. Postpartum blues and all of the other psychological issues that all women have, we are also trained to take care of those. So you can get rid of the internists, you can get rid of the surgeons, you can get rid of the psychiatrists, because you have a specialty that can take care of those issues. And if the men want to come along, we'll talk to the men too. I would like to dwell on an issue that was just touched on peripherally by a couple of our former presenters to you. That has to do with the whole issue of healthcare disparities. Women, if you look at the conditions that affect men and affect women, and some of those outcomes, you find that there is also a gender disparity in terms of healthcare outcomes. With regard to disparities as it relates to minority populations, we find that there is a grave disparity between the predominant population, the white population, and the minority population. I'm happy to tell you that our OBGYN program in our hospital addresses those issues of healthcare disparities. And there are a number of studies that suggest, and perhaps the best one is the study that was done by the Commonwealth Foundation about a few years ago, to show that our national economy would have saved more than $1 trillion over a 3-year period if we could just reduce or eliminate the disparities that exist. That almost $1 trillion in excess costs are spent by our national economy as a result of the disparities in healthcare between the predominant population and the minority population. And I want to suggest to you that as a training program, training obstetricians and gynecologists, where we know that the maternal mortality and morbidity is higher in the minority population than it is in the white population, where we know that the access to care, prenatal care and other things like that are significantly lower in the minority population than in the majority population, where we know that the death rate from almost all of the cancers are higher in the minority population than in the majority population. We need to have a training program where physicians are trained to take care of that segment of our population, and it not only improves healthcare outcomes, but it also has an impact on the amounts of money that we spend in providing healthcare. And so I think that by preserving and maintaining and training more and more physicians in this particular specialty, we will be doing our society a great service. I was at a meeting just recently. In fact, I had to testify before the New York City Council, and I was shocked to find out that there are no private OBGYNs practicing in the Bronx. They're all in a hospital setting, all a big group setting, no private physicians in the Bronx. You go upstate, and there are large areas where there are no OBGYNs in practice. In a state where the majority of the population is women, females. And therefore, my distinguished administrators, I'm sure that there's no doubt in your mind, after hearing this presentation, that if you really want to make a significant contribution, not only to the local community, not only to our state, but even to society generally, where the majority of the population is female, that you will do everything in your power to maintain and preserve this very important specialty of obstetrics and gynecology as the training program at this hospital. Thank you very much.